Forgive the noise in the background. I think there will be some noise because there'll be people walking back. But I've just found a very quiet space where we can sort of sit and have this ask me anything on women's health. I promised. Let me just show you. So, yeah. So we've just got a nice quiet space, and hopefully we can be uninterrupted for like half an hour. So I'm going to be looking down because I'm reading these questions from my other phone. And these questions have come in. You guys have sent these questions into the YouTube channel. So let us just go through them. And like I said, please ignore any surrounding noise, any background noise, please ignore. Okay, so if you're just joining, hi, I'm Dr. Sylvia. I'm a GP and I'm a women's health specialist GP. So my special interest area is around issues related to women's health, sexual and reproductive health care. If you're just checking out the video, make sure you give it a like. And if you've got any questions, you can put them in the comment section. You're welcome to do so. We do have quite a few to get through, so I'm going to give those priority because they've been sent in by viewers of the channel. Hopefully you can hear me okay as well because I've got the mic on. Right, let's get started. So as usual, disclaimer, first of all, this information is for general knowledge. It's general information. It does not replace a consultation or advice from your own health practitioner. I always encourage you to go and speak to the doctor who looks after you, looks after your healthcare, can take all the information about your medical history and provide you the best advice and treatment that you need. But we can definitely talk around issues. And so we're going to start with a question that says, now this first question, it's in response to a video I did looking at treatments for heavy menstrual bleeding and specifically non-hormone treatments for heavy menstrual bleeding. So this question says, Doctor, does this medication prolong your menstrual period? Now we're going to be very organized on this stream because my intention is to clip each of these questions and then share them as shorts. So hopefully people who have sent in the questions or just interested in specifics can go straight to the question that they're interested in. So this is about tranexamic acid, which is the medication I was referring to in that video. And it is a video that is right here on this channel. I will try to put the link. If you're interested in knowing more about this, I'll put the link in my description box. So this question says, Doctor, does tranexamic acid prolong your menstrual period? Right, now, tranexamic acid is a medicine or a drug that's used very commonly to manage heavy menstrual bleeding. Okay, it's important that you know, if you're considering this medicine, important that you know as much as possible about it, which is what your doctor does when you come to speak to them about treating heavy menstrual period. Now, it actually does the opposite to what you're thinking. It's used to make your period shorter or make it lighter. Okay, so it does this because it helps your blood to clot more effectively. So think about this. The bleeding coming from the womb for women who have very heavy menstrual bleeding, the bleeding coming from the womb, large volume of blood coming over a long period of time. Taking this medicine helps the blood to clot quicker. So that will mean the period becomes shorter and lighter. It's different and does the complete opposite things to drugs that we call blood thinners, things like aspirin, things like warfarin, or some anticoagulants, that's the other name for them, drugs, or even some antidepressants, which can thin the blood. And those medicines that can thin the blood actually end up making the period longer. So to summarize, tranexamic acid, which is the question or the drug that we're talking about in that particular video, which is recommended as a non-hormonal solution for heavy menstrual bleeding, will not prolong your menstrual period. So thank you for sending in that question. I hope that clarifies it for you. And if you do need any more advice about this medicine, please do speak to your doctor about it, and they'll give you the best advice that you need for your specific situation. Thank you so much for watching. Please give this video a like. I'd really appreciate it. I'm Dr. Sylvia. I'm a women's health GP. I'm also the founder of yourgpconsultation.com. So if you're UK based and looking to see a women's health GP online, you can go to the link in the description box for this video. You can book a consultation with me and we can have a chat about how to help you get things better. And we're looking at all sorts of women's health conditions, from period-related problems to fertility issues, sexual health issues, menopause, and so on. Okay, so Excuse the noise. Okay, so let's go to question number 2. And this viewer says, I'm 18 and due to irregular periods, I got a very huge blood clot and it's a lot in quantity. That's all we have. For anybody who's saying hi, thank you so much for joining. And yeah, I think there's a troll that is making fun of themselves in the comment section. Let's just ignore them and crack on with what we're trying to do. So this question is somebody who's 18 and has irregular periods and is asking about huge blood clots and a lot of them. So again, let's not forget the disclaimer. I'm just going to see if I can make sure that the noise... I'm just going to see if I can make sure. Just don't want any noise to make this a poor experience for you. So anybody who's watching genuinely interested in mental health issues and finding this useful, please give this video a like. Now, does that help the sound? Does that help to isolate it from the noise? And I'm so sorry. As you guys know, I am at conference. I did find a quiet space, but from time to time, people are going to walk and wander around and I can't stop them from talking. So please bear with me. So I'm going to rely on anybody who is genuinely interested in what we're doing to tell me. But I've got a backup plan. So I'm just going to look at my channel and just see what this sound. Live and you can't hear me. So it's been a long while. So let's see. Let's go to the channel and check that before I go on to the next question because I don't want us to. I sound very clear. Amazing. Very good. Very good. Yeah, let's crack on. Excellent. Okay. So let's go on. I promised myself we're not going to spend more than 30 minutes. Now, I am happy to take any questions on women's health. Okay, but I'm going to give priority to those that have been sent into the channel before now. And thank you to all my viewers who've asked these questions. You guys know I love to hear from you, so keep the questions coming. So we're going to tackle this one about irregular bleeding and a very huge blood clot, and they're large in quantity. So there's no question related to this, but I just wanted to comment on it. Now, passing small clots, especially the first couple of days of your period, that's not unusual. You know, that's when your periods tend to be very heavy. Those are the heaviest days. That's not unusual. But when you say very huge and a lot in quantity, then we have to ask, what does that mean? Excuse me, I have some people talking beside us. You know, what does that mean? And it's always good to check, you know, with a healthcare provider. When we say, oh, heavy bleeding, what do we mean? Now, there are a couple of videos on the channel where I've talked about heavy periods. I'm beginning to think, was this a good idea? Anyway, now, if you're bleeding and having to change your pad every hour, and each time you change it, it's soaked, that's heavy bleeding, okay? Whoever you are, whatever you are, because I know some people can have heavier bleeding than others, and we all have different experiences and tolerances. But if you're bleeding and needing to change your pad every single hour, think about it, and each time you change it is heavy, soaked, that's heavy bleeding. Number 2, if you're passing blood clots, those fleshy material, soft fleshy material, that is basically congealed blood or clotted blood, and if you're passing large amounts, say more than like a 50 pp size, and you're having lots of that, that also indicates you're losing a lot of blood in that clot, in the blood clots. That's just a rough guide. Again, I would refer you back to your doctor to let them know what is your pattern and understand what your bleeding levels. So that kind of clotting where you're passing large clots bigger than a 50p size coin, that level of clotting, you know, suggests that you're bleeding very heavily. Your body's natural clotting mechanism can't keep up with it, okay? Now, having irregular periods at your age, at age 18, can be as a result of hormone balance, right? But I do recommend, especially if you started your period, 4, 5, 6 years ago, so maybe 12, 13, and if that's been your pattern and you're age 18, please go and see your doctor about it, okay? I think it's really important to see your doctor when you first start menstruation, so you're 12, 13, you can have hormone imbalances. That's very common. So yes, periods can be irregular at that time. They can be heavier, they can be longer, they can happen at different times. And because of the hormone imbalance, the womb lining builds up to a very large extent and then sheds suddenly in a large volume. But I would have expected that by age 18, that should really have calmed down and should have a regular pattern. Many of us women have been conditioned to accept, oh, everybody in the family has always had heavy bleeding or irregular bleeding. That's not correct. I think it's important that you speak to your clinician. Let us understand, why are you having heavy and irregular bleeding, and determine, is it a problem like fibroids? Is it a problem like endometriosis? Is it a problem like PCOS, and so on, so that we don't have delays in diagnosis and we don't know what's going on until when you're ready to have a baby, for example. Okay, so that's question 2 that we've just tackled. Thank you so much for watching. Hi, Theresa. Theresa Dalmaida says hi. Thank you so much for watching. And Amaka says, is there any such thing as a long luteal phase more than 14, and what could be causing it, without being generic about one having hormonal imbalance? But the thing, yes, so there is something as a prolonged luteal phase, and one of it can be related to hormone imbalance. And if it's something that you've been told about, so hi, sorry, I should have, Amaka Jennifer, thanks for the question. I should have, said hi before I launched in, but it's something that you should be speaking to your doctor about. And I don't think hormone balance is generic in the sense that that can be one of the causes. So I think it's important that if this has been described for you, if you've done tests or you had a scan and they're saying this is what's responsible, please see your doctor, please speak to your doctor to either arrange more tests or clarify what could be responsible for it. Thank you so much for watching, guys. Please make sure you like the video. I've got 3 of you watching now. It was 12 a minute ago. Now it's 3 and only 1 like. I would really appreciate it if you give it a like, especially if you're here for the women's health questions and not just trolling the video. All right, so the third question, and this is from a guy who says, my wife was diagnosed with hydrosalpinx and given antibiotics. So please ignore the noise or the sound in my background. And it says she puked and is having stomach ache and vomiting. I'm afraid that at home we're not able to find the right way. Yes. So your wife is on this treatment, and she's been given antibiotics. I presume that she's taking antibiotics by mouth. If she's vomiting now, it means that she's not able to keep her medicines down. So she's not really getting the effective treatment, is she? So I would recommend that you go back to the hospital as you were advised, because in such cases, especially if it is persistent or prolonged vomiting, she might need to have an intravenous treatment, have the antibiotics given intravenously, so that they are effective. Otherwise, it's as if she's wasting her time taking those medicines if they're not getting into her system. By the time you swallow a drug, it gets into your stomach, okay? It will be absorbed from your stomach into the bloodstream. That takes time. If you take the drug and then within a short while, maybe half an hour, you vomit, most likely you're going to vomit the drug out with, in your vomit. So it's not going to get into the bloodstream. It's not going to be of any benefit. So please take your wife back to the hospital so they can assess her and then decide if the next step is to switch her from tablets by mouth to having an intravenous injection. So intravenous treatment. So you're absolutely correct to be concerned about this. The treatment that she's getting, and it's important because this, of course, relates to fertility. Hydrosalpinx is when there's a blocked and swollen fallopian tube. And so if the doctors are saying that that they're giving her antibiotics, it means they suspect an infection that they need to clear. So it's really important that she gets that treatment and avoids the effect. Many antibiotics have side effects, which are like vomiting. So of course, it's not surprising that she's vomiting. That can be managed, but I think you need to take her back to the hospital. So thank you so much for that question. Let's move on to number 4. Again, if you're finding this video useful, please give this a like. And of course, questions in the comment section. I'll be happy to tackle them in this Ask Me Anything session. Okay, so I have another question. Somebody says, hi, doctor, I had taken this 72-hour pill. Then my periods are lighter and there's a little blood flow. Is it normal? So taking the 72-hour pill, so what they've done is they've taken the morning after pill, emergency pill, and then experienced a change to their period pattern. Now, I can't remember whether I don't know if this is the question that came with a lot of detail, because I had to sort of move this question from my channel to a different platform to read them out here. But it's very common. And I think if you'd watch the video, so I'm speaking to the person who sent in the question, you know yourself. And I think if you watch the video all the way to the end, you will see that I talk about a very common and expected side effect of the morning after pill. It carries lots of hormones. Okay, so when you take the pill, you're taking a lot of hormones, and what they do is they delay ovulation. Okay, and that means there's a shift in hormones working in your body. That hormone shift is what it just throws your menstrual cycle off track. Okay, so until the effect of that hormone has worn out of your system, you will experience the shift in your menstrual cycle. Okay, so after you've taken the pill, you might have some bleeding soon after taking the pill. That necessarily may not be a true period. It might just simply be the effect of the hormones on your womb tissues. I'm happy to link one of my videos where I explain this thoroughly, how you can either, after taking the pill, you can either expect no change to your period, that's number one, or a delay to your period, that's number two, or your period comes earlier than usual, that's number three, and number four, you might experience a bit of bleeding that is not a period, but it's the effect of the hormones on your womb. So I do have a video where I talk about this. Let us get to the point of this, right? After taking the pill, it is not unusual to experience a withdrawal bleed. That's the fourth example I just mentioned. It's a lighter period than usual, and it's the effect of the hormones effect on your womb. Usually, the effect can vary, can be lighter, it could be heavier. Those different changes can happen, and sometimes some women experience 1 or 2 cycles of bleeding that is not their usual pattern before things settle down, unless of course they take the pill again. So the recommendation is, if by 2 weeks after you've had the pill your period has not returned, then you should do a pregnancy test. If it's negative and you're still worried, or you think you're having pregnancy symptoms like tender breasts, for example, wait till we can repeat the pregnancy test, okay? But if they're negative and you still haven't seen the period, or it's different to normal, calm down, because this could very well be the effect of the pill. Give it another week or two, see your doctor. At any point, if you have any concerns like pain or a discharge from down below, please see your doctor. Okay, so thank you so much for that question. I hope you guys are finding this useful. Thank you so much for the hearts. That's really appreciated. I'd love it as well if you give a like on the video. That would be excellent. So let's move on to question number 5. And this is somebody saying, this is a really interesting one. This is somebody saying, dear doctor, can fibroids stop someone's periods? So she says fibroids have been disturbing her for 3 months. And fibroids have been disturbing her for 3 months. She has not seen her periods, yet she's not pregnant. Her stomach is getting big. She's saying, what should she do? I know many of you who are OGs on this channel, I'm sure you guys can answer that question. Okay, so usually, what do we tell you to expect? Fibroids to make your bleeding heavier. So this is an interesting one, isn't it? Where a fibroid, could it be responsible for delaying or for preventing her periods? Now, just hearing this story, this person needs her GP or her doctor to assess, okay? She needs medical attention. Fibroids usually cause very heavy periods, very heavy bleeding. But there are some types of fibroids which, depending on their location, for example, one called the submucosal fibroid, can sometimes act like something that blocks the womb, blocks the movement of blood from the womb through the cervix, that's the opening of the womb, and into the vagina. So it may be, and the submucosal fibroid is the one that sits just underneath the lining of the womb, but it's jutting into the womb cavity. That's the submucosal fibroid. So it's actually like behaving like a baby in the womb, basically. So if you have one that is in such a position, or is so big that is blocking the cervical canal, that could very well block the passage of blood out of the womb, and then it looks as if you're not having a period. I don't know. I'm just giving you a scenario. But it could act like a foreign body in the womb and block the flow of blood. The other thing that worries me about this is the fact that your tummy is getting bigger. Why? We don't know the answer to that, so we need to look into that, okay? Are the fibroids getting bigger? When you say your tummy is getting bigger, how big, how much bigger is your tummy? You need to see your doctor so they can arrange a scan, so they can have a look. Is there blood within the womb? Is it the fibroid getting bigger? This is so important. So my sister, whoever it was that sent in this question, please see your doctor. Don't wait. Let them get you scanned to have a look at what is going on. Thank you so much for watching. I've got Chitam who said hi. Hi, Chitam. Thank you so much for watching. I've got 19 people who are watching and only 2 likes. Give me some love, friends. Thank you for the person who is pressing on the love button. I appreciate that. But please increase the likes on the video. That would really be great. I think we're on question number 6 now. So let's read through that. Somebody says, hi, hello to you. And thank you so much for those posting the questions. So somebody says, I had a C-section 1 month back, but I still have pain when getting up and down. Is it normal or a sign of infection? So again, guys, let me apologize for the noise in the background. I did want to get this live out before the end of my day. And this seemed like the best opportunity when I'm not moving around or busy doing something else. I've got sort of the next hour free to address this. So there is a little bit of noise from time to time. I'm so sorry, but I think I've got my mic on, so I think you can hear me nice and clear. All right, so this question is, I had a C-section a month ago, but I still have pain while getting up and down. Is it normal or a sign of infection? Good question, really good question. Because it is completely normal to still feel pain and tenderness on your C-section scar when you move around within a month, because the tissues are still they're still healing. You're still in the early healing stage. Your C-section scar just 1 month after surgery, okay? C-section is major abdominal surgery, okay? And when they do the section, don't forget they're cutting through your skin. They're cutting through your fat. Then they're going to cut through different muscles and the muscle of the womb. There's a lot of cutting going on. And with that cutting, they're cutting nerves and cutting other tissues, okay? The healing of all these structures takes time. So please give yourself grace. Give yourself grace. It's not uncommon. But what kind of pain should you expect? It shouldn't be severe pain, okay? Because as you get up and down, you're moving muscles, abdominal wall muscles. So that, that cramping, that tightening of the muscles should hurt, should be uncomfortable. It should not be severe. It should not be severe. When you settle down and relax, it should improve. If you take very simple painkillers like paracetamol, it should improve. And I'm really glad that you asked about an infection, and I'm so glad you're switched on about possible complications. Well done. This is what we want. We want you to be aware and educated. That's excellent. So you're concerned about an infection. So let me tell you what you should expect if it's infected. Thank you to the person who just liked. I appreciate that. Please, guys, give this a like. If the pain is getting worse, if it's getting more intense, okay, if it's getting, your pain threshold, but if it's getting more intense, plus there could be other symptoms you might have. You might feel feverish, you might feel sweaty, you might feel clammy, you might feel sick, feel ill, feel like vomiting, you might, have a high body temperature. All those, you might have a discharge from the vagina, from, down below. And it might be lots of blood at a time when you're not expecting to have heavy bleeding, or it might be a smelly discharge from the vagina. Those are signs, possibility that there's an infection going on. Or it might even be along the scar. So the scar itself, instead of healing properly, starts to look red, or there might be discharge from the skin. It might smell. Some people take off their dressing, for example, and say it smells. There are different, such things could suggest that there's an infection going on. If you have any of this, or you're worried, or you suspect an infection, please see your doctor. Outside of that, if it's a pain like what I described earlier, coming and going, associated with movement, settles down when you're resting or relaxed, simple painkillers settle it down, likely to be as a result of your body's tissues recovering, still very much expected within a month of your C-section. That's a lot of work that you've done having the C-section. So please give yourself grace. But if you're concerned, speak to your doctor. All right, guys, thank you so much. Great questions coming. Don't you guys think these are great questions? I'm really enjoying them, and I really appreciate the engagement on the channel. Please keep them coming so that we can educate ourselves. Okay, let's go to the next question. We're on number 7 now, question 7. Somebody says, now this is similar to what we just dealt with, but let's go through this. So this is question 7. My periods are delayed 1 week, even after taking emergency contraceptive. Please suggest. I don't know what you want me to suggest, darling, but let me teach you about what to expect when you take the emergency contraception, okay? Having a delayed period is the number one expectation. And I do think that when you're taking these pills, I know you're busy worrying about, oh, am I going to get pregnant? Am I not going to get pregnant? I think you should educate yourself. Ask somebody like me, a GP, your family doctor, somebody who's qualified to tell you. If you're concerned about side effects, speak to the pharmacist, for example. Don't just take these medicines and then not know what to expect. It's really important. So a delay in the period is the number one side effect after taking the birth control pill. I've said that already. I don't mind repeating it just in case you're just joining, okay? Now, the pill works by delaying ovulation. In other words, it's going to disrupt your natural pattern. It's going to change it. And one of the effects or one of the outcomes of that change is the delay in your periods. In some girls, it doesn't even delay the period, it brings the period earlier. In some people, they don't see anything, they don't see any change. And so some people don't have any experience of changes to their period. Some people get a bleed around the time of the period, but it's not as heavy as a period would be. And that's actually an effect of the pill itself. It's not necessarily a period. So there's so many different things that could happen. Okay. But while you're, sort of negotiating your experience after taking the pill, please have this in mind. Okay. You're waiting to do a pregnancy test sort of, a couple of weeks. And that's what we recommend. Do a pregnancy test around 2 to 3 weeks after you've taken the pill. If your period is delayed, do the pregnancy test, okay? If you have any symptoms that you're concerned about, so you're feeling sick or being sick, getting severe pain anywhere in the abdomen, the pelvis, any symptoms, please speak to your doctor about it, okay? So the general recommendation will be to do your pregnancy test if your period is more than 7 days late, okay? So that would be the next step I'd recommend for this person. You do a pregnancy test, especially if you feel your period is delayed more than 7 days. And then if it's a negative and you're still concerned, you can repeat that. But of course, I would always direct you to see your doctor. Okay? So thank you so much for those who are on live with us. I got Chris here. Hi, Chris. So where did we stop? We stopped at number 7. Chris says, I'm 48, my period would stop for months. Since starting HRT and progesterone, my period have become irregular, I presume. Also, with the bar in the arm or coal make menopause easier. I'm so sorry, I'm not getting exactly what you mean. So there's some starting HRT. Let me just try and address some of what you said that I can understand. Some women starting HRT can bring about a change to the period. Yes, again, we're talking about hormones, aren't we? So it depends on the type of HRT that you've been provided with. Normally, if you still have your womb, we'll give you a combination of 2 hormones, estrogen and progesterone. Now, today's world with advances, what we have is different strengths, different preparations that have different ways of mixing these hormones, but generally you have 2 hormones, estrogen and progesterone. And if you find that it changes because, I'm keep interrupting myself. The reason we give the 2 hormones is because we want the progesterone to protect your womb from the continuous exposure to estrogen. So the progesterone is the protective effect. And you're being given 2 hormones because we want you to have regular periods. That strategy is usually used for women who are still having their periods so that you continue to have them. So if you're having some irregularities, it's a good idea to see your doctor to check that you are getting the right preparation for your particular background. And then the other bit, so that would explain the first bit. I'm not sure when you say the bar in the arm, I presume you're talking about the implant. So we can use the implant as part of your as part of the progesterone component of the HRT. So hormone replacement therapy for someone in your category can be like taking 2 hormones. So if you already have the implant, then all you might be giving is the estrogen. Okay, so keeping the implant in the arm. Now, that could be one way of doing it. What is more commonly done is for women who have the coil, the Mirena coil or the progesterone coil. It might be Jadis or it might be Kylina, one of our other name in wherever you are. So, but it's just the progesterone coil. And if you have that, that is accepted as the progesterone component of your HRT. So I don't know if that is what you're asking about. That's commonly what we do. And I'm not sure in terms of your clinician, perhaps you already had the implant and they thought, okay, continue with just estrogen since you already have the implant that contains progesterone. So I would recommend going back to them if you're having irregular periods, okay? I would recommend going back to have a conversation with them to make sure that you're on the right combination of hormones, given your medical history. If you're having irregular bleeding, they might need to investigate to find out why is it happening, and and make sure it's nothing, it's not some other cause, because we're thinking about menopause and it could be as a result of that. But it's good to have that conversation to make sure that it's not something else that could be causing irregular bleeding. Okay, so Chris says thank you, you're welcome, absolutely welcome. And I've got another message from Theresa. My menses not coming at all for 3 years. What can I do? And you're 47. So Theresa, let me address this question, even though it doesn't have a lot of information. So your period has not come at all for 3 years. What can you do? So if you're 47, that is certainly within what we call the perimenopausal age. If you haven't had a period for 3 years, I would say that you're menopausal, because we define menopause as absence of a monthly period consecutively for 12 months, 1 year. So a woman who's not seen her periods for 1 year and is within the correct age for menopause or perimenopause is menopausal. Now, I don't know why you're asking this question, because I don't know your medical history, and that is why I would send you back to your doctor to go and have a conversation, because in your mind, unless you have other medical conditions, is there any reason that you're still expecting to have your periods at the age of 47? Perhaps you're wondering that, you're a bit early. Perhaps that's the question on your mind. I don't know. And it's fine. It's a valid question. So please go and speak to your doctor, because you might think, I'm a bit too young not to have seen my period, because what that means is that from the age of 44, you've not had a period. So if that's the case, please go and speak to your doctor so that they can assess you properly and determine if there's anything else that's going on. But from your description, with the little information that you've given to me, sounds that you have gone into menopause. Okay, thank you so much, guys, for the questions. Please keep them coming. And of course, please give this video a like. That will be most appreciated. So my next question is, it's another emergency contraception question. Bear with me, guys. So this is somebody who says they've been taking Plan B, they've experienced spotting, tender breasts, and lots of negative pregnancy tests while being 16 days late. Let me find this question. I think I saw this question. Hold on. Let's just see if I can locate this question. Yes, I think I should be able to read out the exact question for you guys. Let's see if I can. Where is it? So, comments. Okay. So we've covered that. Hang on. It's a long list. I wanted to make sure I went through most of the questions that have come in the last week. So dealt with this one. Oh gosh, it's a very long one. So she says, I had my period on August 25th to August 29th. September 2nd, I took Plan B before ovulation. September 2013 had blood spotting. So the first thing I'll say is well done for keeping the records. I mean, I that's good, because when women come and when was your last menstrual period, many times the answer is blank. I don't know. So well done for keeping the records, because that will be useful for your own medical provider. Okay, really useful. But you're saying that you had tender breasts after experiencing some spotting. You took 6 pregnancy tests and all of them have come negative. On the 21st, you took another, that's 7, and that was before the date of your expected period. Again, it was negative. On September 27 to 28, you took 2 more, that's 9, and that came out negative. Then you said you had a clear, creamy and clear white discharge. No discharge on October 7th. 16 days later, took another pregnancy test and it was negative. Okay, that is a lot of pregnancy tests to go through. And I can only imagine the concern and the worry that is making you take all these pregnancy tests. So let's address this. That is a whole lot of pregnancy tests spread out over time, and they've all been negative. I think that makes being pregnant very, very unlikely. Give this video a like, guys. Please give this video a like. Okay, so every single symptom that you've mentioned, from spotting, breast tenderness, change in your discharge, delayed period, all of these are classic, well-known side effects of taking Plan B, taking the morning after pill. Okay, so basically it's reset your hormone pattern, it's reset your hormone clock. Sorry, I'm shaking the table. It's just reset your hormone pattern, okay? So it can take your body, if you don't have any more Plan B, it can take your body sometimes a month or two, so another couple of cycles before things come back to normal, unless you take another pill, which is why we don't advocate for taking the pill too regularly, unless absolutely necessary. If you feel you have to use the emergency pill more than twice in a cycle, consider getting a regular form of birth control. I would recommend, I would suggest. So you can take your body some time to get back to normal, if you like. If you're so worried, please speak to your doctor. Okay, speak to your doctor. I think the negative tests are reassuring, but obviously you're still concerned. Please talk to your doctor, okay? And then they can advise on what else you can do about it. Okay, let's go on. I promise that we're going to spend half an hour, and we've already gone so long. The next question is, do the changes thin the womb lining? I must decide. Okay, so this is a question that let me just read it directly from YouTube. So we're talking about a video. So this is in response to a video I did on the challenges of living with a thickened womb lining. Okay, and then in that video we talked about lifestyle changes that you sometimes can contribute or support, treatment of a thickened womb lining. So this person is saying, do those changes thin the womb lining? For example, if I lose 80 pounds, reduce sugar consumption and exercise regularly, how much improvement can I expect? I'm asking because I must decide whether to do a D&C now or wait months to try holistic approach. Thanks in advance. Really, really good question. Thank you for sending that in. This is a good conversation to have with your doctor, because in your question, you haven't told us the degree of thickness of your lining that you're experiencing at the moment. But what I will say about the lifestyle approach is that they tend to be supportive treatments. More often than not, they're supportive. So what has your doctor told you? You've had a scan, they've told you that your womb lining is XX thickness. How thick is that? And what are they recommending to you in terms of treatment? Are they recommending further changes? Have they told you that a D&C is going to help them to make a diagnosis, in which case you should not be delaying this, you should go and have your D&C. Okay, so again, this is referring you back to your doctor. Again, sorry guys about the noise, and there are lots of people around me as well, so please bear with me. But I do have my mic, so I think my voice should be very clear despite the sound around me. So are they recommending the D&C, the dilatation and curettage, as they want to treat this condition? Are they saying, have they taken a sample, a biopsy of the womb lining to go and look at what nature of tissue it is that is causing the thickness of the womb lining? Those are important considerations. But any change in exercise, change in weight, change in diet, those are all fantastic. They are good for your overall health. Whether they will provide a targeted change to your womb lining and how much, because that's what you're asking, how much improvement should you expect? I can't tell you. It might be different from one woman to the next, okay? Of course, we know that being overweight and certain lifestyle choices, like perhaps a diet that is very high in processed foods and high in sugar and so on, create an inflammatory environment in our bodies, which contributes to developing thicker womb lining. But we also know that it's a direct effect of high estrogen. So an estrogen imbalance, or having high estrogen, can cause the womb lining to grow thicker. So I will not say to you that, just lose weight and it should be fine. I expect you to start losing weight while liaising with your doctor. about what other treatments they would recommend at this stage. I don't know what that is because I don't know your medical background. So it's a fantastic question. I totally understand it. Please go back to your doctor. They should be able to support you in losing weight. That is great, not only for your womb, it's good for your heart, it's good for your joints, and it's a great way to go forward. Okay, so thank you so much for that question. Let us move on to the next one. Sorry, guys, I'm just checking to make sure. So yeah, lifestyle changes. So let me just make a final word on that. Yes, excess body fat creates extra estrogen, and estrogen is what thickens the womb lining. So yes, being overweight and obese is associated with excess estrogen as well. So it is true that by losing weight, you can amend or adjust that hormone imbalance, bring estrogen levels back lower. But again, without having more information, I would not recommend that alone. That's why I want you to go back to whoever has done your scan, whoever is treating you, to make sure that you're getting the right treatment. Losing weight can definitely help, but is it the only treatment? We don't know. So that decision is not black and white, and your doctor needs to help you to weigh in the risks. And yes, the point I was trying to make about a biopsy was to know the type of cells that are causing the thickness. Is it a abnormal cells? If it's abnormal cells, you should not wait. You cannot afford to wait. Okay, that's treated differently from if it is normal cells causing the thickness. So please bear that in mind. The bottom line is to have a conversation with your doctor, and any lifestyle changes should be part and parcel of any other direct treatment that is based on the type of thickness or type of tissue or cell changes that you have. Okay, so guys, thank you for liking the video. I think we're still on 4 likes, which is a bit of a oh dear. And then so we have another question from Chris, who says, I'm finding I'm getting a lot of pigmentation down the side of my face since starting HRT patches. Oh, hang on. And progesterone tablets. Thank you so much for the like. I really appreciate that. It's amazing when I say, oh, please like, and then somebody just likes. Thank you. That's a lovely feeling. Another one. Thank you so much. I appreciate that. Okay, so you're taking HRT patches and progesterone tablets. Is there anything I can buy over the counter? So my darling, on this platform, I usually do not recommend any kind of treatment or anything you can buy over the counter. I would always ask you to go and sit down with your doctor. It might seem to us as if, it's straightforward, fairly, associated with the progesterone, but we don't know that. I would never make that assumption. I prefer to sit down with you, have a look at your skin, and then conclude after going through your medical history that, it's most likely the HRT patches. And then we can say, right, let's treat it this way or that. So I don't have any over-the-counter recommendation I would make at this point. I would say it's a good idea if it's getting to the point that it's very noticeable and you're worried about it and you think it's related to when you started the HRT patches, please go ahead and speak to your doctor. And then there's a follow-up question from Chris, who says, I'm also waiting to see an eye specialist since I turned 40. I started getting swelling on the cheeks. I've tried lots of things. Could it be hormones? Swelling on the cheeks. I don't like to just blame everything on hormones. Of course, there's a possibility, there's a role. Sometimes as we get to that menopausal stage, we might retain fluid a bit more. But any kind of swelling, I would like to examine it and check where is it from. Is it actually the cheek tissue or is it more around the ear? I mean, I saw somebody not too long ago who had a swelling of the face and it was actually one of their salivary glands. That is a cheek swelling, but it's not a swelling because of hormones. So that's why I always emphasize to you guys, please go and see your doctor so that you can be properly examined. Thank you so much for those questions, Chris. Okay, so let's go to the very next one so that we can move on. So this person says, I'm super worried. Oh gosh, okay. This is question 10, by the way. Let me have a drink. I'm getting dry. Please give this video a like if you're finding this useful. If you're dropping a comment, that would be much appreciated. Thank you. And I hope my volume is okay. Please say it if it's not. I might just walk around, although that would be more distracting because my stand will be shaking about. But let's see if you can crack on. So this next question, I'm super worried. I have PCOS and I'm taking medication, but nothing is working. Thank you so much for the love. Amazing. Appreciate it. Thank you so much. And then she says, I haven't had my period for 5 months now. Okay, so let me see the question on YouTube. See if there's any more context because I'm missing the context in that summary. So let's see. Oh yeah, okay. Yeah, it's it's not too long. Okay. I have PCOS, I'm taking medication, but nothing is working. I haven't had my period for 4 months now. I have acne, slight weight gain, hair growth issue, help. Well, okay, so I don't know what medication you're taking, but good that you're taking something. So that means that your doctors are looking at making sure that you're well and you're safe. So there's some treatment you're getting. I don't know what it is because you haven't told us. But if you've not, so what are the common medications? Usually, if you have PCOS, the common things, if you're otherwise well and have PCOS, one of the common things that we want to do is help you have a regular period. So that way, your doctor might give you, they might prescribe the combined pill, for example. And the purpose of that is just to try and regulate your hormone cycle so that you have monthly periods. Okay, so that's one thing that could be done. Some women might be given a prescription of something called metformin. Again, that is supposed to help you regulate the hormone environment in your system, because PCOS is not just about fertility. There's so many other things. It's not just the reproductive hormones. Insulin is part and parcel. Other hormones are involved in the issue in the whole milieu of PCOS. So I know that we talk a lot about it in the context of fertility. We talk about it in the context of weight gain, acne, irregular periods, and so on. But did you know that there could be a link to developing diabetes? So metformin is given to some women, or women with PCOS, to help to regulate and give hormone balance and manage these hormone imbalances and give you a healthier outcome long term. So we're not just looking at your pregnancy potential. We're looking at yourself, your body as a woman, and making sure that you're healthy. Remember that abnormal imbalance with insulin not just affects the possibility of getting diabetes, it could also cause problems with the heart. It could cause problems with other organs like the kidneys, the eyes, and so on. So it's really important for that. But we're digressing, aren't we? We don't know what medication that she's being given. And I am just postulating and suggesting that if it's one where she hasn't had a period for 5 months, it may be that she's not on the right medication, whatever it is. So it's a good idea that she should speak to her doctor about this. When you haven't had a period for several weeks, months, in this case, the lining of your womb builds up, and then when it eventually sheds, it's with a lot of bleeding. Okay, so I think it's your body saying that you need to look into it. So I would book a follow-up appointment with your doctor, whether it's your GP or your gynae, and say to them, this medication, what exactly is it supposed to be doing? Is it working? Why haven't I had a period? And, we'll get some clarity, okay? There are many different medications. I've only mentioned two, the pill, the birth control pill, metformin, just a couple. And of course, if there's a lot of interest in this, happy to do a further video to expand on this. All right, next question. Thank you so much, guys. The reason I'm giving a break in between questions is so that I know where to click it, because I do intend to clip this into mini segments so that people don't have to watch all the way to the end to get to their question. Hopefully, I'll do this in the next week. So somebody says, hi, I have a baffling cyst. Yay, our first baffling cyst question. Thank you so much for the love. Please give the video a like. I have a baffling cyst. It is small, but it is painless. I can walk, I can run and sit without pain. Oh, wow. Do I need to remove it, or medication is okay? This is the first of these kind of questions I've gotten on baffling cyst. Usually I get, it's painful, or I'm on antibiotics. When is it going to pop, or when is it going to get better? I don't think I've ever seen a question on if it's small but painless, what do I do? Thank you for sending this question. Sorry for the noise. So sorry, guys. This felt like a bad idea. This felt like a good idea when I started this stream. It was a lot quieter, I promise. Okay, let's get on though. Hello, I have a baffling cyst. It is small but painless. I can walk, I can run. So this is a really good question. Okay, if you have a baffling cyst that is not giving you any trouble, it is small, it is painless, you can walk normally. It's not the kind of painful, sweet cyst that you can't sit down. You don't need to do anything. Okay? And I say this with the proviso that I am not your medical practitioner. And I think it's important that you have a conversation with your medical practitioner to get the exact correct treatment for your condition. Because I don't know how large your cyst is and so on and so forth. You've given us some information. Thank you. Okay? But the general rule when we're treating baffling cyst is if it's small, If it's small, if it's tiny, not affecting anything, not causing any problems when you're passing urine or causing any problems during sex, and it's not painful, doesn't need any treatment. You don't need to drain it. You don't need to take any medicines. I have a couple of videos on battling cyst, okay? The gland is different from the cyst, which is different from the abscess. So I don't know, maybe that's what you're sort of conflicted about. If it's a cyst, you don't need to do anything if it's small and painless. An abscess is referring to a cyst that has become infected and there's a collection of pus inside it. So that needs treatment, definitely, okay? So again, I would refer you to your doctor. But a cyst, many women have battling cysts, small painless cysts. They don't even know about it, you know. The only time that you need to see your doctor, we need to do anything active about the battling cyst is if it becomes large. So it might be a cyst that's not infected, but it's been filled with fluid and it's just getting bigger and bigger. So that might be causing problems in terms of cleaning and washing during sex and so on, irritating with your clothing and so on. Or if it gets infected. And if it gets infected, then painful. A large cyst that's not infected can also be painful, but pain is also a special feature of an infected cyst. So painful, getting bigger, hot, can feel hot and extremely, exquisitely painful. This is where women say they can't sit or even to walk. It's rubbing and it's causing so much pain. That is the one that you need treatment and they drain, and that needs treatment at that point. So thank you so much for this question. I think it's a really good way to clarify, what we can do with one cyst or the other. And thank you so much for the love. Much, much appreciated. Yay! This is the last question. Honestly, if you've stuck around, if you've been here from the beginning, you are a star. You're a star. This is our last question. It's a funny question too. But thank you so much for asking. Do you have a video on 4-dice spots? I love this kind of question. So simple. Do you have a video on 4-dice spots? Okay. I don't have a video that's entitled what to do about 4-dice spots. I don't think, but I sort of feel I've mentioned it on one of my vulval lumps or vaginal lumps videos. Now, if you watch them, you know that they're talking about vulval lumps because when you talk about lumps in the genital area for women, they're usually vulval. Some might look as if they're coming from the vagina, and most times that you would have a lump from the vagina is if there is, for example, a fibroid that is extending, maybe a submucosal fibroid that's extending down. It's not very common. So you usually have these lumps around the entrance of the vagina, and that's why sometimes they're called vaginal lumps, but strictly vulvar lumps. Now, what is a 4-dice spot? First of all, it's not dangerous, okay? It's like a very tiny bump or pimple in the vulva or around the lips of the vagina, around the labia. Okay, completely normal. They're harmless. In fact, they can also happen in other places, like around the lips. So some people, if you notice, have little spots around the lips, and they're really basically just oil glands. So the problem is trying to work out which one you have. That's the problem, isn't it? You're not sure whether is it 4-dice spot, is it a wart, is it this, is it that? I totally understand. That can be the problem. But 4-dice spots tend to appear as very, very small. They're either very pale or whitish or close to the color of your skin for us brown, black women. But again, they're tiny. They don't grow to big size. They're not painful, okay? And like I said, you can have them around the lips, even inside the cheek as well. And that, again, around the vulva, the lips of the labia. And they're very common. They're very common. They don't mean anything. They're not representing any disease. They're not sexually transmitted infections. You're not going to pass them from one person to another. They're not a problem. They're part of your body like a skin tag, and they're oil glands. So you don't need to worry about them. Now, sometimes you might be concerned, or it might go to a side that you're not comfortable with, and you want to look at having them removed. It's often not recommended because, again, it's not causing any harm. But yes, you would need to see your doctor to have a conversation about doing that. So Jason says, hi, sorry if already been asked. I suffered terribly with my periods prior to having my son at 18. After having him, my period improved, and after nearly 16 years, I'm now experiencing such painful cramps again. What can I do to help? So I would love for you to see your doctor. You said that you experienced terribly your periods prior to having your son at 18. So we're talking about different phases. You're talking about the time before you were pregnant when you had very painful periods. Then you had your son. Pregnancy gave you a change in your hormone pattern. Okay, and then you had a period of normal, things were normal. I don't know how old you are. I don't know how old you are. So now, women, we always have changes in our hormone pattern. Our hormone pattern is not like a graph that goes nice and smooth at one level. We're always going up and down, up and down, up and down. Every month we're going up and down. When you get pregnant, you're going to have a change for a period of time. Different things can easily have, even stress can affect our hormone patterns. Why are you having cramps? I don't know how old you are. It could be that you're approaching menopause, but I don't know how old you are. And I want you to go and see your doctor and tell him this story so we can explore what is causing you to have painful periods. Have you developed fibroids along the way? Have you developed any other condition? Have you experienced any kind of gynecological procedure that might have caused scars inside you that is responsible? Is it an infection? So many different possibilities. We cannot sit here and say, oh, this is what you should, this is what's causing it. What to do is definitely to speak to your doctor so they can examine and work out what is what was the best treatment for you. So Chris says, thank you, doctor, so much for taking the time to answer. Wow, you're welcome, darling. Thank you so much. And thank you for being here. Thank you so much. And she says she subscribed. Yay, great new subscriber. Amazing. Somebody says, what's the cause of ear ringing? Many things can cause ear ringing. If you're having ringing ears, please speak to your doctor. Now, of course, it could be because of blocked ear canal, wax in your ear. It could be an infection in the ear. Different things. Okay, it's important to speak to your doctor. So, Mommy K, thanks for that question. It has many possible causes. Hi, back to you. Okay, so Jay says she's 34. Right, so that changes things a little bit because I wouldn't class you as being menopausal or perimenopausal, and I would still say go back to your doctor. Again, changes in our period pattern can happen for different reasons. Okay, so hormone fluctuations are common in a woman's life, but for you to suddenly, all of a sudden, it's becoming painful. It's not so unusual, and there could be a very innocent reason, but the point is that we need to understand what the reason is. And so once your doctor has checked everything, including blood tests, they have done a scan, and they're happy that there's nothing untoward, then they can look at possibly hormone related, and then what can we do to treat it. That is the way that we will look at that kind of situation. And Jay, you're welcome, absolutely welcome, darling. Thank you so much for being part of the stream, and thank you so much, guys, for giving it a like. And N. Omar says, and N. Omar is the absolute last question that we're going to take. She says, do you have any advice for vaginal dryness during intercourse after menopause? Something natural, please. So we have 2 videos. I hope I remember so that I can link when I sort of settle down and I'm sorting through this description. I'll link for you where I talk of a lot of different treatments for vaginal dryness, especially around menopause, because there are several different options, including non-hormonal options. So we have hormonal and non-hormonal options. We've got lots of different options. There are simple lubricants that you can get if you're happy that this is menopausal, because again, I'm not your doctor, darling, and I'm not making a diagnosis. So there are different lubricants that can be used if that's the case. If it's menopause related and you're taking HRT, for example, vaginal estrogen is one of the very good treatments that we have out there, but you said specifically non-hormonal. So yes, there are things that you can get. I don't want you to just use any old oil. Please do not do that, because that could make things worse. They're specially formulated lubricants that you can use that are safe, that help, that don't clog up your skin and create more friction and problem down the line, and that you can use on a sort of fairly regular basis, especially around sex. But you've hit the nail on the head. Menopause is one of those conditions that naturally leads to vaginal dryness because of reduced estrogen. Okay, and again, like I said to someone else earlier, I will never recommend anything, oh, go and get this over the counter. No, I wouldn't do that, because I'm not your clinician, and I would love to have the full picture to make sure that I know you and know what can be good for you, what will not cause you any harm before I make any suggestion. If you're in the United Kingdom, you can reach me via yourgpconsultation.com. That's my private online women's health consultation clinic, and we can talk about things. We can look at what is causing the problem and look at getting you the best treatment possible. So guys, we're going to call it a day now. Thank you so much. Absolute stars that I've had on the stream today. Thank you so much for watching. Check out the other videos in my channel. I've got lots of play streams. Omar, if you look on the menopause playlist, you will find there are two videos where I talk about treatments for vaginal dryness. Okay, so you can have a look now. You don't even have to wait until I tell you all this up. Have a look now, and I will share it just in case you don't find it. But please have a look, and you see the different suggestions that I made. Oh, and she says thank you. You're absolutely welcome. Okay, I've got to run. Thank you so much. It's been great hanging out with you guys, and hopefully you'll catch one of my lives again very, very soon. But I hope the rest of your day goes well, wherever you are, wherever you're watching me from. And then we shall see again not too distant future. Take care. Bye.